I might just hand over to Kisani, who's going to take the next session on behalf of Maples, I should say, the director of the Manna Institute. I watch too much TV from Miss Maples, yeah. And Kisani's going to tell us about the Institute and how it actually supports HDR, Indigenous HDR students, and particularly how people with lived experience can have an influence in the work that we do. Over to you, Kisani.
Thank you for that, Uncle Tom. Yama and good afternoon now. I'm not going to introduce myself because I'm pretty sure you know who I am now, and I'm wearing a name tag. So unfortunately, Professor Myfanwy Maple, Director of the Manna Institute, was unable to be here today. Therefore, I am honoured to speak on her behalf as a representative of the Manna Institute's HDR community of practice and one of the leaders of the First Nations working group, alongside Professor Joe Fraser, Pro-Vice Chancellor, Aboriginal and Torres Strait Islander Strategy at the University of the Sunshine Coast. I did have slides, but there were some issues with them, so I'm just going to talk from my speech. The Manna Institute is dedicated to improving mental health and wellbeing in rural, regional and remote Australia. It operates as a virtual institute uniting researchers from the regional universities network, which includes Charles Sturt University, Central Queensland University, Federation University, Southern Cross University, the University of Southern Queensland, the University of the Sunshine Coast, and the lead institution, the University of New England. Our mission is to foster meaningful research, professional workforce development, and the translation of research findings into practical place-based programs. By collaborating with industry and community partners, including EveryMind, Lifeline Direct, and the ANU Centre for Mental Health Research, we tailor solutions specifically to the unique needs of regional Australia. The values of the Manna Institute are deeply rooted in the communities we serve. We emphasise the importance of lived and living experience, recognising that those with first-hand knowledge of mental health challenges are essential in shaping effective and relevant interventions. This commitment to incorporating lived and living experience ensures that our solutions are not only evidence-based, but also resonate with and are practical for the communities we aim to help. A cornerstone of our work is respect for and inclusion of Aboriginal and Torres Strait Islander input and participation. We acknowledge the rich cultural heritage and deep connection of First Nations peoples to their lands and communities. By involving Aboriginal and Torres Strait Islander perspectives, we ensure that our research and programs are culturally sensitive and appropriate, addressing health disparities and promoting holistic wellbeing. To further support the involvement of First Nations peoples, we are committed to supporting First Nations higher degree research students, HDR students, and researchers. We facilitate both an HDR community of practice and a First Nations working group, as well as groups for early career and mid-career researchers. These working groups and the community of practice were created to provide a supportive network, foster collaboration, and ensure that emerging researchers have the resources and mentorship needed to survive in their academic and professional endeavours. The Manna Institute is a vital resource for advancing mental health research and support in regional Australia. Our collaborative approach, rooted in community engagement and respect for lived and living experiences, sets a strong foundation for sustainable and impactful mental health solutions. The Institute's commitment to supporting First Nations researchers and fostering inclusive working groups further underscores our dedication to creating a diverse and equitable research environment. Looking ahead, the Manna Institute is enthusiastic about ongoing collaboration prospects and the drive to partner with like-minded organisations. One such potential partner is the Djurali Centre for Aboriginal and Torres Strait Islander health research and education. By collaborating with institutions like the Djurali Centre, we can continue to enhance our support for First Nations members, share valuable resources, and develop innovative approaches to health research and education. These partnerships are crucial for addressing systemic health disparities and ensuring that First Nations voices and knowledge systems are central to our collective efforts. Thank you.